Welcome to another insightful episode of Me and My Health Up. The purpose of this podcast is to enhance and enlighten the well-being of others. I'm your host, Anthony Harcher. I'm a clinical nutritionist and lifestyle medicine specialist. In this episode, we will be exploring mental health, and we're going to bring in the co-founder and program director of the Banksia Project, Jack Jones. The Banksia Project is a men's mental health charity that seeks to destigmatize and support men's mental health. Welcome, Jack. Thanks for joining us.
Hi, Anthony. Thanks very much for having me.
So, Jack, just tell us a little bit more about you and, how you've arrived at doing what you're doing today, a bit about your story.
Yeah. So I guess for me, a little bit about myself. I really enjoy flipping the script on this a little bit. I like to call myself a good friend. I'm a good family member. I try and support my partner as much as I can, even if I annoy her every now and then. We spend our time down in Maroubra. That's my happy and my safe space. I like to keep pretty physically active and fit, and I do a fair bit of Brazilian Jiu-Jitsu, and I go to the gym and train. And then in my spare time, I also I work for an organisation called the Banksia Project and try and get all that set up. So I'm really passionate about flipping the script on that and saying I'm all these things plus my role.
You're certainly a great guy, and our relationships really evolved, and over the years, through my working with the Banksia Project, and really, have enjoyed your support and love, your passion that you really, you've got so much drive to get out there and support as many men as possible with respect to their mental health, and certainly prevent mental illness. So let's get into, some of this great work that you're doing with the Banksia Project. But I really like the viewers to hear your story around mental health and what got that burning desire really ignited.
Yeah. So I guess for me, it's probably a story that's not too uncommon. I was that bloke that seemed to have it all together. Early 20s. I had just graduated my master's degree. I had amazing friends. I was playing elite sport. Rugby was my sport of choice. I worked in a pretty good job for a uni student, but most importantly, I was always that guy that was there to support everyone else. If anyone asked how I was going, I was all good. Yeah, I'm all good. How are you? And that was really, on the outside, that's how I felt. And I think the challenge was that on the inside, I certainly wasn't all good. I was really struggling to find any concept of self-worth. I didn't feel happy with myself. I didn't feel happy with my surroundings. And I guess my whole concept of self-worth was just non-existent or based on other people's gratification. And I guess that left me in a really tough space. I was struggling with major depression and suicidal ideations for a very long time, and trying to make sense of everything that was going around me. I had all the tools. I had all the education. I had all the support. I had everything that one could need or want. Unfortunately, I still wasn't healthy and I wasn't happy. And that was something that I really struggled with. And I spent quite a few years trying to work out why that was and how that was and all those different things and how I could prevent that. And started coming out the other side of that and just had to stop and ask myself the question, well, if I had all of these resources available, if I had everything that I did around me and still wasn't healthy or happy, how many other people are struggling? How many other blokes particularly, but I'm not phased on gender, are struggling in the community and don't have the access to the support they need, or don't know how to articulate what they're going through, which was the challenge that I had. And also when I did finally work out how to articulate that, the people around me had no idea how to support me, and that often left me feeling worse off than before I actually expressed my struggles. So I came across the Banksia Project as a member of the public. It was a committee of volunteers And I fell in love. I fell in love with the concept of let's give people the skills they need before crisis. Let's teach the community to navigate challenges safely and reach out to the people and stay connected and stay supported so that hopefully they don't go through the same crisis that I went through. And I connected with the founder, Brian Coleman. We worked very closely to help get registered charity status and set up as an organisation. And then I was lucky enough to be offered the first job as a paid staff member. And I've now been doing this for 2.5 years. And that's how I guess I'm now the lucky one. The decision I used to make every day was, did I want to make it through the next 24 hours? And the decision I make every day now is how I can help more people get through their day. So I'm really lucky that I get to do this every day and connect with amazing blokes like you and James Unan, who you had on here a few weeks ago. I truly think I'm the lucky one that gets to do that and call it work.
And you're certainly living what you lived before around that giving. It's always that giving, but now you realize the importance of giving back to yourself and that self-care. And just, in respect to mental health, one of the parts of recovery of mental health is obviously accepting that there is a problem and acknowledging that problem. At what point, because you mentioned it went on for a couple of years, at what point did you, say, well, I need to get some assistance here and reach out and express that vulnerability? Because that's often what holds men back, is saying, well, I've got to put on this image, I've got to, you played first grade for Sydney Uni, how can a first grade player that plays elite sport, be susceptible? So, at what point did you really reach out during that journey of, wanting to improve your mental health?
Look, I think for me, it was an interesting one. I probably got a softer introduction into the support space than most. I struggled a lot with performance in rugby, keeping myself on the field. I just could not stop getting injured, which meant I was very close with the medical staff that I had at Sydney Uni, and they were phenomenal. And I think they identified, particularly there was a sports doctor in that clinic that identified that I probably wasn't doing too well mentally as well as physically. So I did start seeing a sports psych who probably started picking up that this wasn't really a performance thing. It had nothing to do with the sports performance. It was more about the mental health and mental illness space. I did keep in contact with that clinician sporadically, but for me, it was a call that I had to make to Lifeline. In fear of crisis or being in crisis and wanting to make sure I was kept safe. And that call really spurred me to say, look, I can't keep doing what I'm doing. It's obviously not working and it's not healthy for me or the people around me. So I need to seek more ongoing and structured support.
And this is what I really connect with around the Banksia Project, is it is a soft introduction. You don't need to have a mental health issue or concern or diagnosis to be part of the community. And, the Banksia Project embraces anyone and everyone. And so that's, one of the great things about having the Banksia there is it's a real soft introduction to supporting men's mental health without that stigmatization around it. So share, with the listeners as to what the Banksia Project is all about and how they help people.
Yeah. Look, Anthony, I'm sure you could do this just as much as I could. And as for anyone who's listening, Anthony has been fundamental in our journey from that startup space and one of our OG facilitators. So thank you for that. But yeah, we're a community of connection support. We're about providing people with the skills they need, the audience they need, and the space they need to talk about their emotions safely. One of the things that we're really clear to identify is this isn't just for those who are struggling with their mental health. We actually like to think of it as a gym for the mind. We work so hard to stay physically fit. Anthony, you more than me, but we work so hard to stay physically fit, but unfortunately we don't tend to work hard to stay mentally fit and mentally resilient. So what we try and do is give spaces, tools and audiences for blokes particularly to communicate their emotions, to learn more about how they can navigate challenges, and most importantly, have that safety net of a team, have support around them so that no matter what they're going through, be it good or bad, there's a group of blokes that have just got their back, and they've got that safe space to just say whatever they need to and not be judged, be supported through that, and guided to health and well-being. The last thing that is really important about the work we do is it's all clinically designed and clinically supervised. So if any of while it is peer-based and community-led and community-run, we're the first to say that we're not clinicians. And if anyone is experiencing a more complex mental health challenge, that needs to be dealt with by a clinician. So whilst we're hoping to prevent the need of clinical intervention, if someone is at that stage, we hope to be a really soft introduction to that clinical support. And that's, metaphorically, but also literally, if I can book my mate the appointment, if I can drive him there, if I can sit outside and make it really achievable and accessible for him to seek clinical intervention and clinical support, that's a really effective role we've played as those community members. So, as I said, it's that community safe space to stay mentally healthy and well, but also being that triage to further clinical intervention if necessary.
Just on that point of, providing that assistance and helping be that bridge to, getting that initial help, because, as through firsthand experience that bridging that gap is difficult, and you had a more softer introduction. But for those listeners that, particularly if they're female listeners that, have a loved one, whether it be partner, brother, dad, that's, they're concerned about their mental health, how can they approach the subject? You got any tips in terms of how to make it easier to bring the subject up? Is it a certain environment, timing, or how have you dealt with this in the past? Because that's one of the difficult things, is that people often know that they have the loved ones around them, but it's such a difficult subject to bring up.
Yeah. Do I have any tips? How long do you have? I think it can be a tough subject, but particularly for those who are listening and people sort of say, okay, well, you're a men's mental health organisation, so if I'm not a male or I don't identify as a male, I don't need to listen. Where I think this is a topic that affects everyone, because men in Australia particularly are unhealthy. We're hurting ourselves and we're hurting the people around us. And so I think it's really important that we all play a role in actually keeping men happy and healthy and well. One of the things that I like to identify is particularly for women in the space, that quite often they play the most important role, because a lot of men don't feel comfortable reaching out for help with other men. When we're around our mates, when we're around our colleagues, our peers, if they are male, we tend to be reserved and we show that tough, stoic, I can get through anything personality. You can't break me. Whereas when we're quite often when men are around females, they tend to be more comfortable showing that vulnerable side. And there's a few reasons that I believe that is. And one of those is I think we need to give permission for others to be vulnerable. And to do that, we need to be vulnerable ourselves. Now, it's quite common that females are willing to be vulnerable and willing to say, yeah, this annoyed me, or this upset me, or this made me feel really poor. And men take note and they go, well, wow, she's just done that and she's okay. Whereas I think amongst blokes, we don't tend to have those conversations as often. So if there is a female in a bloke's life, they may be concerned about how they're going. I think there's a really important role to play. It's, identifying some of the signs that might be occurring. It's saying, I know that this happened at work lately and I know that's stressing you out. I've seen you starting to behave in this way, whether it's withdrawing or becoming very anxious or angry, whatever the symptom is, and saying, are you okay? Or more importantly, how are you? And then let that person just take that conversation wherever they want and follow up with more questions. I think as blokes, we're very good at skimming the surface and talking about one thing, the next thing, the next thing. And women are really good about asking the next question. Okay, what's the emotion that lies behind that? Why do you think that occurred? What would you do differently? Who do you think that affected? And unpacking that situation more. So I think really just giving, and most importantly, just providing a non-judgmental space for that individual to talk about whatever they want. And no matter what the answer is, we don't need to worry about the circumstances. We don't need to worry about how we relate to that. We just need to deal with how that person's coping and the emotions they're expressing and help them express that more. And most importantly, that we can't be the solution. So if anyone is listening and they want to help someone in their community or their family or whoever it is, the best thing they can do is get them to clinical support, get them to the professionals. And that may start at the Banksia Project. And that when we may then get them to the professional, but you are not the solution. You're the caregiver. Let's get them to the solution. And the best role you can play as a family member, as a partner, as a friend, is getting them to that professional support.
Great response, Jack. I just, I've had experience with this myself, and initially in the early days, I really, just had that awkward struggleness as to, I won't come up with the right words. I'll offend them, and often I still today, struggle with my words. And but what I realised is just approaching the subject and bringing it up, they more get that holistic picture of you or feel of you, in the sense that they feel the energy that you really care, and they're not really, the words don't matter so much. And so I've never really worried about rehearsing the lines that I'm going to say, or ask the person. It's more just approaching the subject, and obviously picking the timing, that you want them to be by themselves and feeling comfortable, but just raising it up, just like you said, in terms of, I've noticed these behaviors, it's just not you. And is there something going on? And allowing them to speak, and, really that listening, listening intently, and really feeling how they're feeling. I think once, when you get really present with them, they can sense that, and they'll just keep sharing.
I think as well, there's a few things that come to mind when you bring that up, and you're completely right, Anthony. I don't think we ever all get the words right. But as you said, I don't think the words are the most important part. One of the things I like to emphasize is it's not about being there for someone. I think it's about being there with someone and just sitting with them and saying, I don't care what you're experiencing or what you're going through, but I'm here with you. And I don't care if it's for 5 minutes, for 5 hours. Your comfort and me caring for you is the most important thing for me right now. And I'm here for the long haul. And I think, as you said, those softer things like the feel and the energy, and that showing that you're there with that person through whatever they're going through goes a long way to say, look, I can help you navigate your problems.
Absolutely. It's fundamental, isn't it? Just having that, or just knowing that there's people out there that have your back and that are with you on this journey. Because, when you're in that state of mind where you're withdrawing and you feel that everything's against you, and you actually don't feel like there's anyone that cares really, and essentially there's a lot of people that care, but they just probably not aware of what you're going through. And I think once you express that vulnerability and share it with one person, you as the person that's experiencing it feels more comfortable with sharing it, because you realize the benefit in just sharing a little bit about what's going on. You might not share the whole story, and then you get more and more confident in sharing it, and you share it with more people, and then eventually that network around you builds. And I remember from a personal experience when I went through a divorce, I was horrified. I didn't want to tell anyone, but it was really affecting me. It was, sitting with me. It was on my mind all the time. And I was, I felt very alone. And then I remember just sharing it once, and it was well after the separation. And the relief I felt was incredible. And I thought, wow, this is just therapy, just talking about it, mentioning it, as opposed to, I was going to functions and giving excuses as to why my wife wasn't there. So I certainly, learned firsthand how important that just sharing this part of it. It doesn't need to be the whole story, but just getting something out, because it just builds that confidence within that. This person's actually listening, and they're really concerned about me, and therefore I feel supported by that person. And then you share it with something, because at the end of the day, we're humans. We're here to support and help one another.
I think as well, if you think about that as well, Anthony, I think you're not unique or alone in that feeling of, I don't want to share this. But I mean, how many people do we all know that have been divorced? And in saying that, how many people do we all know that have been divorced and experienced tough emotions associated with that? You know, I don't know anyone who wouldn't feel challenged by that, but until we, you know, are willing to reach out and connect with those people, we're not going to gain the insights or the support that they could provide. And that's something that's so hard to just get across the line. It's once you do share, you will have the support, you will have the connection, but you've got to take that leap of faith. On the flip side of that, you know, one of the things that I always bounce back to is when I was struggling, I probably needed a few really clear things from the people around me, but they're overwhelmed by the conversation. They may not have the tools to navigate it. They may not have the experience or the education. And so some people, you know, behave differently to how they normally would. Some may engage more, some may withdraw. You know, they might say, okay, I just need to give that person space, whatever it is. But if I'm that person who's in the challenge or in the struggle, and I can be really clear with the people around me, I just need this from you. You know, if I think about a bloke who's 20 years old, he doesn't know what to do and probably withdraws from the conversation. Whereas if I was to say to him, mate, I just need you to text me once a week saying, how are you? Are you doing okay this week? He'll go, shit, all the rest is just noise. It doesn't matter. This is all I need to focus on. And so if we are that person who's in the struggle or in the challenge and you may be listening, try and be clear with the people around you about what you need from them. And then hopefully that will make their job easier and also make you feel better with them as well.
It really is that universal law. You know, we really need to put out what we want in order to receive. If it's not put out there, then, you know, it won't come to us. So I think the more we put it out there, the more we're going to receive what we want. So, you know, if this person wants more and more support, then they will get more and more support by just, you know, sharing that. So,
absolutely.
Is there anything else you wanted to add to that?
No, look. I think the only other thing I'd say is this is what we've covered a lot on is about if you are that person in the struggle. And one of the things that Banksia is all about is let's deal with those people before the struggle. So they've already got the support network in place. They already have vulnerable conversations and they're comfortable doing so. They already know what their self-care looks like and what their triggers may look like, and they know who's there to help them through that. And putting all these things in place in a proactive way so that they're getting mentally resilient. Rather than waiting for the challenge to occur, being in the bottom of that slump and going, how do I get myself out? Hopefully we can avoid getting in that slump altogether, which is what we're all about, you and I, in our different ways, and also when we come together at Banksia.
Absolutely, Jack. And it's a very good point. Let's shift to the prevention side of things. And, you know, you mentioned the Banksia is there in that preventative space in terms of, you know, providing men that supportive community. In addition to that, what do you recommend, or the Banksia recommends, that people do in order to maintain that good state of mind, that mental gym? So what is it that people can do on an everyday basis to really stay mind fit, so to speak?
Yeah, great question. One of the things that I am really clear about is we all have mental health. You know, we all have mental health. We don't all have mental illness, but we do all have mental health, and we need to invest in that health daily to stay healthy and stay happy. And so for me, rather than focusing on, you know, what can I do in 6 weeks, it's what can I do every day? What are the habits and routines that I can create that make a healthy lifestyle and keep me well? And I think what's important to define is that what keeps me well is going to be different to what keeps you well, Anthony, or whoever's listening. And so we need to spend time actually identifying and articulating what they are to ourselves. For me personally, I really focus on, you know, physical wellness. I think for me, it all comes to capacity. You know, challenges are inevitable for all of us, and we're all going to have things that pop up and we go, I did not expect that. How am I going to get through it? But if we're not giving ourselves or not leaving any capacity for those challenges, they can really derail us. Whereas if we're doing things that we feel comfortable on a day-to-day basis, we leave ourselves with the capacity to actually deal with those challenges really effectively. We've got the bandwidth, we've got the physical health, we've got the mental health to just go, oh, that's it's not easy, but I've got a solution and I can actually act on that. So making sure that we have the capacity to deal with the challenges that are inevitable. For me, there's a few ways that I manage my capacity, and it's balance. It's keeping my physical health well. That's something that I find if my physical health is deteriorating or I'm not investing in it, I notice and the people around me notice. Often Catherine, my partner, will say, stop talking, go to the gym, come back and talk to me after that. Things like that. But then also, I'm sure, as you may have heard of, nutrition can have a big impact on our mental health. I don't know if you know that, Anthony. But a whole range of things. I notice if I start eating bad, or perhaps I might have a few drinks on the weekend, it affects my mental health. But also, I think something that probably doesn't get enough attention is sleep. I think sleep is for me, it's my go-to. I need a good 8 hours. If I don't get that, everyone will know about it. And the smaller routines that we can implement that keep us well, so that when these challenges pop up, we've got the bandwidth and the clarity to deal with it safely.
Yeah, I love how you mentioned that term capacity, because we've all got a threshold, and I guess that threshold is we want to keep well under that, and
Correct.
in order to keep well under our threshold, which is, as you said, different for everyone. But when we burst out, well, particularly men sort of express their frustration, or not so things aren't going well through anger. In order to avoid that threshold, it's like Catherine says, you're on the verge, go to the gym or get out, go for a run. And so I like that terminology, and I think it's great because that's, nutrition really fits in with that, just keeping well below the threshold by eating well. You mentioned sleep, and I totally agree with you. Sleep is massive, and we don't, in the Western world, we're all, well, generally not getting enough sleep. And 40%, the stats are 40% are sleep deprived. And that's those that report it, right? So there's plenty of people out there that, poor sleep goes unreported. So that's the only, the ones mentioning it to their GP. But that's huge, 40%. Then you look at the mental health. We know that, it's one in 4 or 1 in 5 that, will experience a mental health concern over their lifetime. And there's certainly so many studies that link sleeping and, poor sleep. So like severe chronic sleep, sleep deprivation for long periods of time is directly associated with poor mental health outcomes, whether it be heightened anxiety. And, that heightened anxiety is that over the threshold, as you mentioned, and depression. So, and then, it just flows on, from that sleep, it flows on to nutrition. When you're sleep deprived, you don't eat well, you over caffeinate, and it just compounds. So, I think you touched on some, real fundamental areas where we can support ourselves on a regular basis in terms of good habits. What do you do around, because, you mentioned, and throughout we've mentioned the importance of human connection. And it's, it's not just going out and partying with your mates, right? So, define what's important around human connection, and how do we get more of that, or we actually, how do you schedule it into your day? This, because we are talking that deeper level of human connection, not that, we talk the footy and, we have a beer and all that sort of stuff. It's more that deeper conversation that we have with people.
Yeah. Look, I think for me, call it lucky, call it unlucky. When I went through some pretty severe challenges, it meant that I had to redefine and reassess a lot of my relationships, so that a lot of my relationships now, the people around me know what I've gone through, and they now know that they're part of my support network. And we don't need to have, some people may have hundreds of people that are part of their immediate circle. I call it the circle. Some may have 2. It doesn't matter how big that is, but making sure that we've got our own safe spaces. When I went through the challenges I went through, the people around me now know that that's a reality that I may face, and if I need to have that conversation, they know they're my people for that. And so I make sure that I've got my people, I've got those safe relationships and safe spaces that no matter what it was, I can call them up. It doesn't matter if I've spoken to them once a day or once a week or once a year. I could call them up and say, this is one of those times that we've spoken about before. But for those people who, I would say luckily, or maybe are feeling well, establish your safe spaces now. Um, Go and tell those people, you know what? If I was to be struggling, you're one of the people I'd call. And these are some of the things that pop up in my life that can sometimes stress me out. And most importantly, these are the things that make me feel better. So if I can make that proactive call and I can call someone and say, look, this is one of the times we spoke about, I am starting to feel challenged and I'm starting to behave in this way, they can go, well, let's do the right things that help you feel better. But for me, it's really about having those authentic connections and conversations where there's no judgment. And I think my partner is she's my rock. She's the one that I can just say whatever it is, and there'll be no judgment, and she'll go, yep, okay, how do we, not even solve, just listen. And I think finding those people, finding them and letting them know they are those people. And as I said, you may have 100, you may have 2, it doesn't matter, but make sure you've got those people. And most importantly, if you don't, come to the Banksia Project. That's what we're trying to do. We're providing that safe space, we're providing that support and making you feel comfortable actually using it. Because we all have people around us. We all have people that are going, I want to support, I'm here to support. But we don't always utilize that. We don't always know how, and they don't always know how to support effectively. So come to us, find your safe space, find your team that can be your support. And then hopefully we can also guide you to creating new safe spaces and safe networks around you in your existing relationships as well.
So how can people contact the Banksia?
Very easily. We're all over the internet. We try and be very active on social media, but our website is www.thebanksiaproject.org.au, or the Banksia Project on Facebook and Instagram. We have a few different options available where we have amazing community members like yourself that we put through some training, and we say, we want you to own this and we want you to support your community. We'll give you all the guidance you need. We'll give you the structure. We'll give you the frameworks. And most importantly, we'll give you the safety of clinical support, but you're the champion of this. And that makes it relevant when we're going to work with different community groups or different locations, or whether it's rural towns. We're giving the tools to them. We're just supporting them and guiding them to do so. Or alternatively, just come and be a participant. Come and find out what it's all about. Come and find your safe space. And really get mentally fit. It's a gym for the mind. It's get mentally fit and healthy and resilient. Give yourself the capacity to deal with more turbulence as it comes up, and it will. We say it's a 2-hour commitment a month. A 2-hour growth room is what we call them. And a 2-hour commitment provides ample amounts of hours either side of that, because you've given yourself health and well-being and mental clarity, which isn't always easy to find.
Absolutely, Jack. And I can certainly vouch for that firsthand, having, being the facilitator of a growth room in the eastern suburbs, and just, seeing the men when they first come in the room to where they are, a couple of years after continually being, consistently coming to the growth room. I think that's a key thing, is that, it's not just a turn up once and, things are going to improve. It's very much that.
Sorry, mate.
Yeah, you're right. It's very much that consistency, like you do when you're going to the gym. It's consistency where you're going to get the results. It's consistently making the time and effort, which is only 2 hours a month, to go along to a growth room, and the growth will happen. I've seen men transform themselves. I personally got transformation out of it. It's absolutely incredible. So I thoroughly recommend anyone listening, that if you know of someone that could benefit from the Banksia, please share this podcast with them. Certainly direct them to the Banksia website or Facebook, and go along with them. And if you can't go with them and you're concerned about how can I get my loved one to a growth room, connect with Jack or James Unan, who was also on the podcast, and they will, let you know what's some strategies that you can apply to help this person get into the room. Once they're in the room, the magic unfolds. So it's absolutely incredible. So really recommended.
Yeah.
So You want to add any?
I was just going to say, sorry, I don't want to do a James Union on you and not stop talking. I can't wait for him to hear that. But I think as well, you know, the Bondi Junction growth room, which started almost 4 years ago now, it's still, that group still supports each other. I heard people from different groups as well, you know, things like, I wouldn't be getting married to my wife this weekend if it wasn't for the support this group's given me over the years, or I wouldn't be getting this job promotion, or who knows where I would be if it wasn't for the support and the guidance and the comfort of this group. And, you know, you can't put a price or a time on that. All programs are entirely free, just to be clear, but, you know, giving up 2 hours once a month to provide that support for others while also getting support yourself is phenomenal. I personally, as you said, I've seen the growth of so many men who don't have any mental health problems, or some do. And you know, I've seen that growth eventuate. I've also been lucky enough to experience it myself, and it's just phenomenal. So for anyone who is listening, I can't recommend it enough. Give yourself 2 hours a month and really invest in yourself, most importantly, and get involved.
And I agree with you, Jack, in terms of building, you know, if you don't have those key support members you mentioned earlier, the Banksia is phenomenal in terms of embedding deep relationships, people that care, that support you, have your back. And yeah, I see many strong relationships form through the growth rooms. So yeah, totally agree. It's you'll get some lifelong connections, and you know, members that, you know, came into the Banksia with, you know, severe mental health concerns are now facilitators because they've evolved and grown so much through the process that they now want to give back to the community. And so now they facilitate rooms. So it's just beautiful to see that growth of people and, you know, where they've come from and where they are today. And yeah, it's just phenomenal. It's so simple in terms of the model, in terms of how it operates. But it's so impacting.
Yeah.
So thanks, Jax, for sharing your experience, your knowledge, and if, as I suggested, listeners, if you know of anyone that could really benefit, you know, suggest you recommend them listening to this podcast. Hear Jack firsthand about the Banksia Project. He, you know, has provided some great tips today in terms of how you can increase your capacity, increase your resilience, and, you know, prevent mental health concern down the track by that ongoing investment into your mental gym. So please like and share, and get the word out there. We want as many people to hear about the Banksia Project. It's a great cause. It's a charitable cause. You know, if you're not in a position to donate your time and support, or you can also donate money to support the growth of the Banksia. It's certainly evolved. You know, there's so many rooms happening over New South Wales, within Sydney, now into the country. And Jack, have you moved interstate yet?
We have. So we had programs running in Canberra, and with COVID, we obviously we went digital. So we've now got programs. We're training volunteers from all across the country virtually, and we're running programs virtually across the country as well. Which, you know, we've got people up from Mackay down to Adelaide. We've got Melbourne. We've got Brisbane. It's just phenomenal. And we're really excited to be able to provide support for Aussies across the country, no matter their location. But for those volunteers as well, if all we need is 2 volunteers from a community to put their hand up, and we can set up a face-to-face growth room in that area as well. So, you know, it's an amazing place that we're at. We're also working with some really major community organisations, corporate organisations, sports teams, all the above, to provide support. And really, you know, for us, it's not about you know, how big and the empire. It's about how many men we can support, and how many healthier fathers and sons and brothers, peers, mates, colleagues, whatever it is, that we can create and we can help, and therefore create healthier communities. And that's the whole goal.
Making a huge positive difference in a world that's struggling at present with mental health. So yeah, get behind, support the Banksia Project, and stay tuned for more insightful episodes of Me and My Health Up. Thanks, Jack.
Thanks, Anthony.